acquired risk factors are things that we acquire through our lifestyle or the environment in which we live, for example. So things like social, demographic factors could be perceived as acquired factors, and they may not necessarily be modifiable. Other acquired factors, such as medications that we may take that may reduce our saliva flow, they can be modifiable because we can change the medication to one that doesn't reduce our saliva flow. And in caries, the risk factors that were looked at were reduced saliva flow, either hyposalivation or reduced saliva flow. And there was clearly evidence that this is an important issue in caries. Medications, then medical diseases, such as diabetes, and in caries most of the evidence is for type 1 diabetes. When we looked at the periodontal diseases, then diabetes again is a very, very strong risk factor, but it's type 2 diabetes in periodontitis as opposed to type 1 diabetes, and this probably just reflects the fact that periodontitis tends to be a disease that happens not so much in children but in younger adults and older adults. Smoking is perhaps the strongest of the risk factors for periodontitis, other than plaque accumulation, obviously. So smoking, there is again a dose-response effect with smoking as a risk factor. It is modifiable, we can reduce smoking. There are other forms of tobacco use as well, and again there is some evidence for other forms of tobacco use in periodontitis. Cardiometabolic conditions in periodontitis were also discussed, so this would include things, as well as diabetes, it would include things like sleep apnea and obstructive sleep apnea. And there is emerging evidence that these conditions may be associated with periodontitis risk. The other acquired risk factors in periodontal diseases were hormonal changes during pregnancy, puberty, and also potentially the menopause. Where the evidence is weak, but there is evidence that patients with rheumatoid arthritis have an increased prevalence of periodontitis. It's difficult to know whether one causes the other because patients with rheumatoid diseases can't clean so easily, so they have more plaque. Is it the plaque? Is it the rheumatoid disease? It's almost a circular argument. So the final factor in periodontal diseases is obesity and the metabolic syndrome. There is evidence that patients who are overweight or obese or have the metabolic syndrome have a significantly increased risk of periodontal diseases.